Here's something most doctors won't tell you straight. After 50, your body doesn't play by the same rules it did at 30. And nowhere is that more true than when it comes to ejaculation frequency. Maybe you've noticed changes. Maybe things feel different than they used to. Or maybe you're wondering if keeping up a daily routine is helping you or quietly working against you. I'm Dr. Revita, a physician specializing in men's health, and over the past decade, I've had hundreds of conversations with men in your exact position. Men who want straight answers without the awkwardness or the medical jargon. So today, we're going to talk openly about what actually happens in your body when you ejaculate daily after 50. Not myths, not locker room talk, just medical facts you can actually use. By the end of this video, you'll understand exactly how your body responds at this stage of life, what the real risks and benefits are, and most importantly, how to make choices that support your energy, your health, and yes, your intimate life. But before we start, do me a quick favor. Tell me in the comments which country you're watching from. I love seeing how many men around the world are taking charge of their health. And while you're there, hit that like button and subscribe so you don't miss future videos where we tackle the questions most men are too uncomfortable to ask. Now, let's talk about what's really happening inside your body. Here's the first thing you need to know. At 50, your biology has fundamentally shifted. Your testosterone levels aren't what they were at 25. On average, men lose about 1% of their testosterone each year after age 30. By 50, that's a 20% drop. And testosterone isn't just about desire. It fuels energy production, recovery time, and even the quality of your orgasms. Your prostate has changed too. For most men over 50, the prostate has enlarged somewhat. That's normal, but it means the gland is working harder and ejaculation frequency can either help or strain it, depending on how your body responds. And here's what surprises most men. Your refractory period, the recovery time your body needs between ejaculations, has gotten longer. At 20, it might have been 20 minutes. At 50, it can be 24 to 48 hours or more. So when we talk about daily ejaculation after 50, we're not just talking about frequency. We're talking about whether your body has the resources to keep up. Let me walk you through what actually happens, both the positives and the warning signs. Number 1, prostate stimulation. The double-edged sword, let's start with your prostate, because this is where daily ejaculation after 50 gets interesting. On the positive side, regular ejaculation helps flush the prostate. Research shows that men who ejaculate frequently have lower rates of prostate inflammation and possibly reduced risk of prostate cancer. But here's the catch. If your prostate is already enlarged or inflamed, daily ejaculation can actually irritate it further. Some men report increased urinary urgency, a feeling of incomplete emptying, or even pelvic discomfort. The key is listening to your body. If you feel relief and better urinary flow, that's a good sign. If you feel pressure, discomfort, or worsening symptoms, your prostate might be telling you to slow down. Number 2, energy depletion versus energy balance after 50. Your body's energy reserves aren't infinite. Ejaculation triggers a cascade of hormones: prolactin, which makes you tired, oxytocin, which relaxes you, and a temporary dip in dopamine. At 30, your body bounces back quickly. At 50, recovery takes longer. If you're ejaculating daily and feeling constantly drained, foggy, or unmotivated, that's not coincidence. Your nervous system needs more time to reset. Your zinc and magnesium levels, both crucial for testosterone production, may be depleting faster than you can replenish them. But if you're still feeling energized, sleeping well, and waking up strong, your body may be handling the frequency just fine. This is highly individual. Number 3, testosterone and recovery cycles. Here's something most men don't realize. Ejaculation causes a temporary spike in prolactin, which suppresses testosterone for several hours. When you're young, testosterone rebounds quickly. After 50, with already lower baseline levels, frequent ejaculation can keep your testosterone in a suppressed state more often. Over weeks and months, this can show up as reduced muscle mass, increased fatigue, mood changes, and yes, even weaker erections. It's not that ejaculation is bad. It's that your body needs adequate recovery time to restore hormonal balance. Some men find that spacing out ejaculations to every 48 to 72 hours gives them noticeably more energy, better gym performance, and stronger sexual response when they do engage. Number 4, ejaculation quality and satisfaction. Here's a truth many men don't want to admit. After 50, if you're ejaculating daily just out of habit or compulsion, the quality of each experience often decreases. You might notice less volume, weaker contractions, or a sense that climax isn't as satisfying as it used to be. That's because your body literally hasn't had time to replenish seminal fluid, restore neurochemical balance, or rebuild anticipation. But when you give your body time between sessions, many men report the opposite: more intense orgasms, better erections, and greater satisfaction overall. There's a bigger question underneath all of this. And it's not about frequency. It's about why. Are you ejaculating daily because it genuinely feels good, relieves stress, and enhances your life? Or are you doing it out of anxiety, habit, or to avoid facing something else? After 50, this distinction matters more than ever, because compulsive patterns don't just affect your energy. They can mask deeper issues like depression, loneliness, relationship disconnection, or fear of aging. I've had patients who realized their daily routine was actually a way to self-soothe, not a source of pleasure. And when they address the underlying emotion, whether through better sleep, exercise, or honest conversations, their relationship with ejaculation became healthier and more intentional. Let me share the patterns I see in my practice that cause the most problems. Mistake 1, ignoring the body's signals. Your body is always communicating. Fatigue, brain fog, reduced libido, weaker erections, these aren't just getting older. They're feedback. If you're feeling these symptoms and still maintaining daily ejaculation, you might be overriding signals that your body needs more recovery time. Mistake 2, using ejaculation as the only stress relief. Life after 50 brings stressors: career pressure, aging parents, health concerns, relationship changes. If ejaculation is your primary coping mechanism, you're setting yourself up for dependence. Healthy stress relief looks like a toolbox: exercise, social connection, hobbies, mindfulness, and yes, sexual release. But it shouldn't be the only tool. Mistake 3, never experimenting. Most men never actually test different frequencies to see what works best for their body. They just continue whatever pattern they've always had. Try this. Track your energy, mood, sleep quality, and erection strength for 2 weeks at your current frequency. Then adjust. Go to every other day or every 3 days. Track again. You might be surprised at what your body prefers. Here's the truth. There's no universal rule, but there is a framework you can use. Ask yourself 3 questions. 1, how do I feel afterward? If you feel relaxed, satisfied, and energized the next day, that's a green light. If you feel depleted, unmotivated, or regretful, that's a yellow flag. 2, is this enhancing my intimate relationships or replacing them? If you have a partner, is daily solo ejaculation taking away from your sexual connection with them? Sometimes, frequent solo activity can reduce motivation for partnered intimacy. That's worth examining. 3, am I doing this because I want to or because I feel like I have to? Compulsion feels like pressure. Choice feels like freedom. If you skip a day and feel anxious or irritable, that's a sign the behavior may have crossed into compulsive territory. Based on what I see working for men in your age group, here are some evidence-based suggestions. For most men, every 48 to 72 hours this frequency allows full hormonal recovery, adequate seminal fluid replenishment, and maintains the benefits of regular prostate stimulation without overtaxing your system. If you're trying to conceive contrary to old advice, daily ejaculation isn't necessarily better for sperm quality after 50. Every other day optimizes both volume and motility. If you're experiencing fatigue or low libido, consider spacing it out to every 3 to 4 days. Give your testosterone, zinc, and magnesium levels time to rebuild. Track how you feel. If you have an enlarged prostate, work with your urologist. For some men, more frequent ejaculation helps. For others, it aggravates symptoms. This is individual. Always prioritize quality over quantity. One deeply satisfying, fully present experience is worth more than 7 rushed, disconnected ones. If you're concerned about maintaining sexual health while finding your optimal frequency, these nutrients matter after 50. Zinc, crucial for testosterone and seminal fluid production. Most men are deficient. Aim for 15 to 30 milligrams daily. Magnesium supports relaxation, sleep, and vascular health. Glycinate form works best. 200 to 400 milligrams before bed. Vitamin D. Low vitamin D is linked to low testosterone and erectile dysfunction. Get tested and supplement if needed. Omega-3s support cardiovascular health and blood flow, both essential for erections. These aren't magic pills, but they give your body the raw materials it needs to function optimally. Look, I want you to feel empowered to make your own choices. But there are times when professional guidance matters. See a urologist if you experience pain during or after ejaculation, there's blood in your semen, or your urinary symptoms worsen, you notice a sudden change in erection quality, you feel like ejaculation has become compulsive, and you can't stop even when you want to. These aren't signs of weakness. They're signs that something specific needs attention. And the sooner you address it, the better the outcome. Let me finish with something important. After 50, many men fall into a trap. They think their sexual prime is behind them, that they need to hold on desperately to what they had at 25. That's not how this works. Your body at 50 isn't worse than it was at 25. It's different. And different doesn't mean diminished. It means you need to adapt. You might not ejaculate daily like you did in your 20s, but you can have deeper, more satisfying intimate experiences. You can maintain strong erections. You can feel vital, energized, and confident. It's not about chasing youth. It's about honoring where your body is now and giving it what it needs to thrive. And here's what I know from working with thousands of men. The ones who do best after 50 aren't the ones who try to force their bodies into old patterns. They're the ones who listen, adjust, and focus on quality over quantity. So here's what I want you to do. Don't just consume this information and move on. Take action. This week, pay attention. Notice how you feel after ejaculation. Notice your energy the next day. Notice your mood, your motivation, your sleep. And if you're feeling consistently drained, try spacing things out. Give your body 48 hours between sessions. Track what changes. Because the goal isn't some perfect number. The goal is feeling strong, vital, and alive in your own body. If this video helped you, please share it with a friend who needs to hear this. Leave a like so more men can find this message. And subscribe to Dr. Revita so you don't miss our next video where we'll discuss the one mineral deficiency that's quietly destroying testosterone after 50. Remember, your vitality isn't gone. It's just waiting for you to support it the right way. I'm Dr. Revita. Take care of your health. You're worth it.